for it to become more widely accepted, basic, I think the fact that you're doing this kind of conference enhances the awareness of people, the need for these kind of things in private institutions and in government institutions. And we start working towards how we can co-opt this system into our existing system, how we can add this on to probably not just cancer, but I think any debilitating disease needs emotional and psychological support. Whether it is there's so many diseases which are like the terminal illnesses or people who have got less chances of survival, all those things. So this is not, I think, psycho-oncology is a specialized field because oncology is so specialized. So it needs someone who's an expert. But at the same time, I think we can't now go on creating. I think it's people should not feel offended, but for every specialized field, we can't have a specialized counselor. I think every hospital first, if they can provide a general counselor, a general psychologist for all these kind of patients, so that whether it is an oncological treatment or whether for a neurological treatment, whether you've got some other fatal disease, for all these kind of patients, if there is a psychiatric and clinical psychologist and that kind of a support provided by hospitals, I think it will have a great impact, and that should become part of any treatment that is provided by hospitals. And when I looked at the opinion of all the doctors, nobody was saying that this is not needed. But we think how we can bring it in to our system, how we can make it affordable, how we can bear the cost. Ultimately, everything is a cost, but finally the cost is borne by the patient. Nobody else is going to bear the cost. Either the hospital management will bear the cost, or any service provider will bear the cost. The patient has to provide. So, how do we? And so whether it is how do we bring it in, and whether we can make it optional, or the availability of the resource. So there's so many factors. So I would request Dr. Brinda also whether anything that from the government she expects us to do. Definitely we will try and incorporate those things. We can look at those things. What we can do. Any specific suggestions if are given by you or by anybody over here. We will definitely have an open mind. And like our policy which you mentioned about the right to end life and for palliative care, I think we took a very historic decision on that. Where now today in Karnataka you are legally allowed to have a medical directive that if this thing happens to me, this is the way I want to be treated. And suppose someone is fatally ill, there is a procedure now to where legally doctors or the family can take a decision to end the person's life. So these are things that we did after a lot of consultation with a lot of people, and with some people who came forward saying that this needs to be done. And similarly, on this, anything that you want us to do, government's priorities are many, and our focus is always on how we can, we've got so much of load as it is, and so much of work, that we need to do to ensure that our people get, people are more healthy. So the pressure is always on the immediate. So these things, I think with support of private organizations, NGOs, think tanks, definitely we can work with them. Like how Dr. Vishal is here, we worked on the tobacco eradication program, how we made the laws more stricter, and we took some decisions which ultimately has benefited society. So like that, we are willing to play a role, but I think your organization and your efforts I think I want to appreciate that. You've taken a lot of interest, and it's not easy to bring all these people together, and you've done that. So hopefully, this will lead to better outcomes in the future. So thank you for also making me a part of this. Thank you.